Well, I wanted to bring her in today after, for the past week or so, whenever I put her outside, she gets confused and lost and doesn't come back to the door, so I have to go out and find her.
Okay.
And the last time she was under a bush, just kind of staring like blankly into space.
Yeah.
So I'm pretty concerned.
Yeah, well, I'll check her out real quick. We'll do a quick physical examination, and then I can ask you a couple questions, and we'll try to figure out what's going on with Fluffy.
Okay.
So, hey, little girl. How you doing? Let's see. Okay, well, she's looking good despite her, older age. How old is she now?
She's going on about 12.
Okay, so she's getting up there.
Yeah.
All right. Well, I'm going to use some sort of like diagnostic aid. I'll ask you a couple questions, and we'll see where to go from there. And just say yes or no, or
Okay.
how often. And you said she's how old again?
12.
Okay. All right. So, does she ever wander aimlessly?
Yes.
Okay. Does it appear lost or confused in the house or in the yard?
Both.
Yeah,
Yes.
like you just said. Okay. Does she get stuck in corners? Just kind of stand there? Or?
Not yet.
Okay. What about staring into space or at walls?
Yes.
Okay. Does she have difficulty finding the door? Like standing at the hinge side or standing at the wrong door?
She has a doggy door and she doesn't use it at all.
Okay.
Use it at all anymore.
Okay. Does she not recognize familiar people?
No, she snapped at one of the kids the other day actually, and that's not like her at all.
That's not what you want either. Okay. Does she not respond to verbal cues?
No, not the way she used to.
Or her name?
No, not really.
Okay, let's see. Does she forget the reason for going outside? Will she kind of stand out there and look around?
I think that's what's been happening.
Okay. Does she seek attention less often than her usual?
Okay,
Okay.
definitely.
Is she less likely to stand or lay down to be pet?
Yeah, she used to be very affectionate and not so much anymore.
Okay. Is she less enthusiastic upon greeting?
Definitely.
Okay. Or does she no longer greet you guys?
Yeah, actually, when the door would open, she'd usually come running, and it's not been like that the past month.
All right. Now, about her sleep activity, does she sleep more than usual?
Yes, during both the day and night.
Okay. She might be getting up there, like sleeping more, but something more abnormal than that.
Yes.
Okay. Does she sleep less during the night?
Yes. She'll get up and pace and wander around.
Okay. What about a decrease in purposeful activity?
Definitely. She doesn't really want to throw the ball around or play with her toys.
Okay. And on the opposite end, does she show an increase in aimless activity like pacing?
Definitely.
Okay.
Paces a lot.
Okay. Does she ever urinate indoors?
Yes.
How many incidents would you say like per week that would happen?
At least maybe 2 to 3 times a week.
Okay. And about defecating indoors?
Yes.
Okay. And do you know how often that would be? About the same?
About
or
the same.
Okay.
As urinating.
Let's see. Does she urinate or defecate indoors while you guys are watching?
Yes. For the most part, her attention isn't on us anyway.
Okay.
So.
What about using the bathroom as soon as she gets outside or inside from being outside?
Yeah, like I'll let her stay out there for a long time. Wait. She won't go. Bring her in, and then a couple minutes later.
Okay. And does she signal to you less often to go outside?
Yeah, she doesn't let us know at all. So we just regiment taking her out.
Okay. All right. Well, considering her older age, she is getting older, but using these questions that I've asked, it is an indicator of CDS, which is canine cognitive dysfunction syndrome.
Oh.
And it's sort of similar to dementia in older people.
Okay. I can understand that.
So it's just something's going on in her brain, and we're going to try to help her with that.
Okay.
It can't necessarily be cured, but we can give you a drug, or I can prescribe you something that will help with the clinical signs.
Okay.
There is something called Anapril. If you're interested, I can tell you how it works, and I'll show you what's going on in Fluffy's brain. Let me show you what's going on in Fluffy's brain. These are neurons in her brain, and they're going to send messages to each other in the form of dopamine in this case. And dopamine is responsible for a lot of things, but in Fluffy's case, we're looking at her behavior and sometimes like her motor capabilities. In a normal brain, we have the synthesis of dopamine here, so they're making it. And once it's made, it'll be released, and it'll pass the signal on to the next neuron. And dopamine's a neurotransmitter, and so it'll attach to these receptors, and then it'll send the information along again. It can also go through the process of reuptake. It can come out into the synaptic gap, and it'll come back in and reattach to this neurotransmitter. So this will send messages in the brain, and it'll cause normal functioning, basically. What's happening with Fluffy is that she has a decrease in dopamine levels. That's what we think. Now, this drug, Anapril, how it works is that it will inhibit something called MAOB. MAOB is a degrading enzyme, and what it'll do is it'll take dopamine and it'll break it down so that dopamine can't pass the message along. So this drug will inhibit it, so MAOB can't do its work. If it can't break down dopamine, then there will be more dopamine to go around. And this will hopefully help. They've seen in a lot of studies that after a month, many of these dogs, almost all of their symptoms have been alleviated, I guess.
Mm-hmm.
But that being said, the MAO system of the enzymes really, it's really complex and it's not completely understood yet. They're still looking, much research is being done. But so the full spectrum of consequences is not, like, we haven't seen everything yet.
Mm-hmm.
So I want you to look out for really atypical or abnormal behavior or just bad responses to the drug. Like if she's vomiting, any diarrhea or excess salivation or a sudden loss of appetite, I want you to look out for things like that. And if that does come up, give me a call and we can bring her back in and we'll reevaluate. We'll see what we're doing. I'll start you off on the most mild dose. It's about 0.5 milligram once a day, and in the morning preferably. You can wrap it up in cheese or put it on peanut butter, however you get her to take her medicine. So like I said, in the morning, and this prescription, it's a pack, about a month. And towards the end of the month, you should hopefully be able to see some changes
Okay. Wow.
and hopefully get the old Fluffy.